Time now for our weekly look at the future of healthcare. The World Health Organization is warning of a global dementia epidemic. But one of the most abundant elements on Earth could hold the solution. Iron is key to numerous brain functions, although too much of it is toxic. Researchers in Melbourne showed 2 years ago that iron levels in the brain can predict when someone will be struck by Alzheimer's. Well, now they hope to show how removing excessive amounts can stave off the disease. Joining us from Melbourne is Michael Woodward, who is leading the study at Austin Health. Michael, let's get to the iron story in a moment, but first, can you give us some idea of the burden that dementia is going to be placing on the health system globally?
Yes, at the moment it's costing the health system about $1 trillion per year. It's estimated that by the middle of the century we're going to have about 150 million people with dementia, mainly Alzheimer's disease, and that's going to cost about $2 trillion per year. Most of it is care in residential places, but a lot of it is related to care in the home as well.
Okay, well, are we ready for this burden? I suspect the answer is not.
I don't think so. I think this is a huge impost that is coming like a tsunami. We talk about diabetes and obesity and other global security issues as being what we should be worried about, but I think dementia is something we need to be very concerned and focused on. That's why this work between the Austin and the Florey is, to me, very important.
Yeah, well, let's talk about some of the work that you're doing now. It might be best if I just ask you to describe it to us. It is to do with reducing the amount of iron in the brain and the connection that that has to Alzheimer's disease, correct?
Indeed, as you stated at the beginning, there is a link between iron and our brain function, our cognitive function. There was a study some decades ago in Canada that showed that twice-daily injections to remove iron seem to improve cognition, seem to improve memory, and we're trying to do that again, but with a larger study, a well-structured study, using an oral agent rather than an injection twice a day. The study is going to involve about 170 people, and it will go for 1 year. That's how long the person's in the study, but it will take some time to recruit that number of people. So the whole duration will be about 3 years. I'm hoping that this will be a brand new approach to this epidemic of Alzheimer's disease.
Well, Michael, how come it's taken so long, though, to expand this approach, to restart this, I suppose, and sample this on a bigger basis?
Betty, the brain is a very complex organ, and I think we've tried to oversimplify it. We've believed that the main problem is from a toxic protein called amyloid, and there's another toxic protein called tau. And most of the therapies, most of the trials so far have targeted those particular toxic proteins. And they may yet work. We are moving towards using larger doses of drugs targeting these proteins, using these drugs at an earlier stage. But those studies have yet to produce an effective drug. So we now need to look at other approaches, and that's why this is so refreshing. We hope that using data that we already have and using a simply available drug, we may be able to make a difference in a way that the other trials so far have failed to do.
How soon might you know if it's working or not?
Look, it'll take about 3 years to complete the study, and then we have to look at all the data. So none of this goes at breakneck pace, but it's very important that we continue our endeavours. There's a number of other approaches that are being looked at, not all targeting the toxic proteins, tau and amyloid. Of course, there's a lot more to Alzheimer's than just trying to cure or prevent it, and we've got to look at better care systems, better information, education, right, destigmatisation. There's a range of issues, but in terms of a specific therapy, this is promising, and we feel that it's worth a trial. So our National Health and Medical Research Council, in conjunction with the Florey and the Austin Hospital, have funded this trial, and we hope that we will be able to show that we can actually delay the onset or slow the progression of Alzheimer's disease in those who are already showing memory symptoms.
This is such a terrible disease, Michael. I mean, why is it so complicated to tackle? I mean, why is it so hard and intractable to find a cure or a treatment for this?
the brain is found to be a pretty tough nut to crack, if I can use that pun, if you like. The fact is that the brain is probably the most complex organ in our body. It's our computer. It does so many things, and it's got so many different systems in it that it's difficult to think that one particular approach is ever going to do much. We've had very, very slow progress against other degenerative diseases of the brain, such as Parkinson's, multiple sclerosis, motor neurone disease, Lou Gehrig disease. So we need to accept that the brain is tough, but it doesn't mean that it can't be cracked. It doesn't mean that we can't come up with some very effective treatments. We just need to try, we need to try harder, and we need to keep trying.
Michael, as a layperson, I've always associated a lack of iron as impairing brain function because of a lack of oxygen to the brain. But you're saying too much can bring on Alzheimer's. How does, we're all familiar with anemia and not having enough iron in your diet. How does somebody end up with so much iron that it puts them at risk of dementia?
It may be that it's not so much excess iron, it may be just the normal amount of iron that's toxic for people who are building up these proteins. So if we can lower their iron levels through the use of medicines, we're likely to, we believe, likely to make a difference. Yes, iron is necessary, and I'm certainly not advocating that people reduce the amount of iron in their diet. That's not an advised approach. But we hope that by removing iron with this particular medication, we can make a difference to those who already have the building up of proteins. These are people who are already building up the toxic amyloid and tau proteins. So this is not something for people who have got no worries with their memory at all. This is for people who are basically already on the 20 or 30 year journey to Alzheimer's, because we recognise it does take a couple of decades to build up these proteins before we start having memory problems and then we start losing function and develop dementia.